Why should you stay at home if you haven't been exposed to COVID-19 and you don't feel sick? Sri Lanka has taken several steps to limit public movement and large gatherings in order to encourage people to stay at home. All of these measures are being carried out in an effort to slow the spread of COVID-19 and to flatten the curve. But what does it mean to flatten the curve? As the virus starts to spread, it initially only infects a few people. As more and more people are exposed over time, the rate of infection increases. In Sri Lanka, we had the very first national case on 11th of March. However, as the weeks passed, we saw a steady increase in the number of cases and, over the last few days, a much more rapid increase in the numbers infected. As with most viruses, the number of cases will continue to grow till it reaches a peak, after which the number of cases will start to drop as people start recovering. If precautions are not taken to slow the virus from spreading, there will be a rapid increase of cases that will exceed our healthcare system's capacity to respond. However, if we implement precautionary measures such as isolating patients, keeping those exposed to the virus in quarantine, and practicing social distancing early, the spread of the virus can be slowed, resulting in a much more gradual increase of cases that our healthcare system can respond to more effectively. Flattening the curve means that we reduce the speed at which the virus spreads and reduce the number of total cases over time. What can you do? At an individual level, there's a lot you can do to stop the virus from spreading. The government has asked everyone to practice social distancing. This means staying home and avoiding crowded places like work, school, public transport, and social gatherings. Obviously, social distancing isn't possible for everyone. Those in essential services and those who cannot work from home have no choice. But if all of us who can stay home do our part diligently by avoiding all non-essential interactions, we can all play a part in significantly reducing the spread of COVID-19 in Sri Lanka. This is especially important as symptoms of COVID-19 can take between 2 to 14 days to develop, so people can be infected and contagious without knowing it themselves. So don't treat these days like an unexpected holiday. There is no need to panic, but by practicing these precautionary measures, you can protect yourself, your loved ones, your community, and your country by staying indoors and avoiding all non-essential interactions. Frequently washing your hands with soap and water for 20 seconds. And practicing good respiratory hygiene, like sneezing and coughing onto the inside of your elbow or a tissue. Break the link today. We all have a role to play in Sri Lanka's response to COVID-19. Spread the word, not the virus.